Okay, I think we are live. We have few minutes to wait.
We have 7 minutes, so we won't start prematurely.
So we are live now.
Good evening, everyone. On behalf of MDSI, it's an absolute pleasure to have two giants of neurology, Professor B.S.Singhal and Professor Kailash Bhatia, with us today for this wonderful session. It's an absolute pleasure to welcoming both of you, sir.
Thank you very much, Shili.
Professor
Thank
Bhatia,
you. And thanks to MDSI for asking me to do this interview with Professor B.S.Singhal, which is a real pleasure and privilege for me. I worked with Dr. Singhal as a house officer and subsequently also when I was a registrar at JJ Hospital, Grand Medical College, many years ago now. And I never imagined that we'd be doing this sort of an interview. So, sir, I'm going to call you sir still.
No,
I'm from the Indian Gharana.
No.
So,
I love
some
that.
years ago, you asked me to call you Bhim, but that won't happen. So you are sir for me always.
Kailash, in fact, even as a house physician registrar, I thought I was learning from you. You continue to teach. You were very bright, in fact. I think you
Thank
came
you,
from
sir.
Dr. Vakil's unit, isn't it? You worked for Dr. Vakil, B.J. Vakil, did you? Or not?
I worked with B.J. Vakil as well, yes. My first job was with B.J. Vakil, Sharat Shah, and then the second one was with you. And then later on, I came back to do my DM neurology with the Katrak and, of course, with you. So I think Professor Singhal doesn't need any introduction at all. However, I think for the uninitiated and for a number of people who are listening into this, I just want to sort of give a brief outline about a very brief bio. And then I'm going to really have a little interview and a chat with him, basically to find out about his amazing journey and really to sort of find out what makes B.S.Singhal tick. This is what I think everybody wants to know. So Professor Singhal is currently the Director of Neurology, Bombay Hospital Institute of Medical Sciences. He was the Professor and Head of Department at Grand Medical College, JJ, between 1981 and 91. He was the President of the NSI in 1986. He was the Regional Director of the Asia-Oceanic Chapter of the WFN in 2006 to 2009, Chairman of the Asia-Oceanic Section of the MDS, the Movement Disorder Society branch from 2009 to 2011. He has over 200 publications, very important, several guest lectures. He received a number of awards. I just want to mention a few here, which are prestigious. The B.C. Roy National Award in 1999, the Priyadarshini Academy National Award, the Dhanvantri Award in 2009. And he has a lot of research interests. I remember myself, this interest in multiple sclerosis and Devick's disease, myasthenia, and more recently, movement disorders. He set up the Parkinson disease MDS association. So he's really been really the doyen of Indian neurology for a very long time. He has trained so many of us, and he has literally a school of his own, known as Singhal School. So I remember my first interaction with Dr. Singhal when I was my house officer. My very first patient, who was a Guillain-Barré, And it was an early morning ward round. Dr. Singhal came very early in the morning, and he asked me about the case, and I told him, I think, I've been told it's Guillain-Barré. He says, what do you know about Guillain-Barré? And I said, I've just heard about it. So he said, well, you had 3 days. By now, you should have known everything about the disease. If people wanted an opinion about Guillain-Barré, they should have come to Kailash Bhatia. So you should have read about it. So he's very, thorough academic even from that time. And this was very useful for me as an experience in my life. So Dr. Singhal is a man of few words, but the words which he says are always pertinent. And he likes to have things structured. So this interview or chat is going to be partly structured and partly unstructured. So in your life, I know that I've been stalking you, and I have a little resume about your lives. So we're going to start off before you became the head of JJ Hospital, from the time from Mount Abu and your pre-medical studies, and then subsequently, of course, you went to England. So I've got a few slides here as a cue for you. So Jaslavin, can we have some of those slides, please? So that's Mount Abu. This is the Maharaja College. The Brook General Hospital. Housie. And we'll want to know from you why we put this. Maidowell. And then 3 individuals. And now the floor is yours.
Well, Kailash, I think, thank you very much indeed, and very good afternoon to you. And you really have done a good bit of research as to my journey in life. And back to Grant Medical College and JJ Hospital and Bombay Hospital. Really. So I really wanted to know how Mount Abu, as you know, is a small town, hill station. And, my father actually came from Haryana. And of course, I was only 7 when he passed away. But the population was 4,500 when I was born there. But anyway, I studied in the municipal high school, but teachers were dedicated. They didn't care much for the salary, but they cared more for teaching. So that really imbibed good things in me. Scouting, and we also had Red Cross and all that. And we were also, the Madam's Memorial Hospital was nearby to inspire us to become a doctor. We used to go along. And also we used to teach the uneducated people a little bit. And then from then on, of course, passed the high school, went to Maharaja's College, which you showed me. I was there for 2 years. And then the question became as to which medical college I should join. There was still the domiciliary question. Mount Abu was still in the state of Bombay state. It was a combined state, Gujarat and Maharashtra. So I was not a sort of domicile of Rajasthan. And really, but still, one could get some sort of a domicile from a nearby city, Sirohi, and I could be admitted to the SMS Medical College. And there was a difficulty in getting admission to Grant Medical College because they only took people who came from universities affiliated to Bombay University. So that became a very difficult situation for me. And my family wanted me to come to Bombay to broaden my horizon. But luckily, they had 4 seats for students from other universities. And I was lucky to get reasonably good marks to be one of them, to be selected to come to Bombay. And really, I think Grant Medical College, when I came, I really fell in love with the college. It's a although we stayed in the old hostel, with much, but it was a great college, great camaraderie, great friendship, good friends, and really, I think I enjoyed the years as a student. And I was very fond of chess, but I gave up very quickly. because I thought that it was very time consuming. And I used to spend a lot of time listening to commentary on cricket, which I also gave up and just resorted to playing only hockey for the college. But it was, we lost many games, of course. We used to turn up only for the matches, not practice. But we had excellent teachers, indeed. And when I finished the MBBS, then I did the house job under Dr. Sadhe and Dr. D.V. Narula. Do you remember him?
Yes, yes.
He was my guide in a way. Dr. Wadia had just come back. And he said that whatever you do, you must get to the unit where Dr. Wadia is. And therefore, it's under Dr. Menino D'Souza, where Dr. Jassa Moose was there.
Yes.
Dr. Wadia was there and Dr. Wazirani. Do you remember him?
Absolutely.
Dr. Wazirani actually was physician helping also the physician who were looking after the Tatas. So I think that was a very good time for me to have Dr. Wadia and Dr. Moose as my mentors. So I think it was a great time, and that is when people like you came along to teach us. In fact, I remember you, and I remember the others who came along. Even Rajan Kale, who came to.
Yes, that's Rajan Kale was my senior registrar. Yeah.
So I think there was a lot of learning, and Dr. Wadia, as you know, was an amazing person. I mean, he was very organized in his thinking to start the sort of joint rounds on Tuesdays, which is still continue today. He also, started on the teaching on Wednesday when the students would come from all over, and he would come in the morning when we would listen to him, and he had some interesting cases to tell us about, very, very interesting cases. And it was a great learning, although they were honoraries, but they never took time away from the hospital. If the time was from, say, 8:30 to 12, they would be there up to there and would be available even after that. So he would come back if there was an emergency. An emergency was very well attended to. And he also made it a point that if anybody referred any case to him in the outpatient or wherever, the reason for referral must be written. It can't be just kindly see and opine, which unfortunately tends to happen quite frequently these days. But he had a meticulous record system, so we could really dwell on that. And from then on, of course, when I got to the MD, Dr. Wadia gave me sort of introduction to Dr. Ronnie Henson. Dr. Henson, as you know, was the junior to Lord Brain at the London Hospital. So he gave me letters of introduction to his friend, Peggy Orton, and he also to another colleague of his, and to Dr. Ronnie Henson. But there was no availability of a post immediately. So 7 days I stayed in a sort of near the Queen Square, but I was restless. So BMJ House I went to and got a job, which was in fact in a geriatric hospital, where the life was very cozy, but the persons, two Pakistan gentlemen and the Indian who was staying there, told me it's too comfortable for you, so immediately you should leave the place. So I stayed in that hospital for 7 days, and I immediately went to a suburban hospital in England, near the beaches, where I did the house post. I was there for about 7 or 10 days, and then I got the job where the hospital that you showed, Brook General Hospital. That was a neurosurgical job.
Neurosurgery, yeah.
Yeah, and like Dr. Wadia at the Newcastle, didn't want to go to the theater. I'd also made a caveat that, look, I'll be in the ward, but don't call me into the theater. Because I didn't like to wear the apron or put on the gloves. In fact, I was too clumsy. Only once, like Dr. Wadia, I also went in the theater, but they realized that was not my cup of tea. So I used to work on the ward, so that was very enjoyable. And of course, I was there and I think wrote the histories, which they quite liked it. I think that was Dr. Wadia's training. And then I went for the Edinburgh examination in Edinburgh, the MRCP Edinburgh. And there, I think it was very interesting that for the long case, the examiners came and left me with the angiograms and S3s and everything, and they said, this is the case. You have about 45 minutes you can look into everything that you want. And I realized that that was a trap. So I, having taught by Dr. Wadia, I relied only on the history and clinical examination. And when they came there and they asked me, have you seen the angiogram? I said, sir, I have only listened to the story and examined. I kept away from that. They really liked the presentation, and they asked me where was I trained. And I mentioned my mentor, Dr. Wadia. So, and I think this way, getting through the Edinburgh examination was not difficult. And then there was still some time. So I came to do a locum registrar post at the Bradford Royal Infirmary. So there, of course, the consultants were shying away from the neurology cases, which I could handle more easily. I was there for about a week or 2 weeks. And then I came to Stoke-on-Trent doing another research, and then Gerald Stern, whose picture you showed, he was very kind, very, very perfect gentleman who was very, very, of course, he adored Dr. Wadia, and he informed me that there's an opening coming up at the Mayfair and I should apply. So I got the interview call over there, where, of course, Dr. Henson and the other, senior consultants were there, along with Valentine Lowe. So they, of course, I think with Dr. Wadia's introduction, it was obvious that there were 3 others who had also come for the interview. And Dr. Valentine Lowe only asked me one thing, do I know how to do the lumbar puncture? I said, sir, I have done many. So I think that was the only question that he asked me. And 3 people asked me, what my future plans are. And they gave me the job. And I really enjoyed I think it was a small hospital, but we used to go along to Queen Square to attend where you might be taking on Wednesdays still?
It was, there were 2, Thursdays the was round now, so yes.
Okay, I see. I used to go along on that day. We never wanted to miss that. And we also had Sandifer, who used to go along to Great Ormond Street. So I used to tag along with him to the Great Ormond Street also.
Yeah.
So I think it was a good learning experience.
Yeah.
So the Mayfair Hospital was a very homely place. And after having finished that, of course, the question was to come back to India. Dr. Wadia, in fact, at that time, before, I think he had gone to, as you know, South America for the tropical neurology, and returned, in fact, to his friend Peggy Orton. And we were wondering, where is he? Because there was no news. And then we learned that he had been in a jail in Lisbon.
Yes.
But I must confess that even then, he was thinking of the Department of Neurology at the Grant Medical College. And he was also thinking about me as to what I would be doing. And Dr. Wadia had informed me that there would be an opening at Bombay Hospital, and they want a full-time person who would be allowed to be attached to the teaching hospital. So I think it was Dr. Wadia who gave me, and therefore I had sent my, sort of application for appointment. The other contest was Dr. Anil Desai, who was very senior. But I think Dr. Ginde, wanted someone whom, was coming. So he even wrote about a guy from Lord Brain as to how I was doing. Lord Brain said that he had retired, but from his colleagues, results are, the reports are not unfavorable, they're quite favorable. So I got appointment to Bombay Hospital. And also when Dr. Wadia came, of course, we were overjoyed. And I got appointed as the assistant honorary over there. So I think that the journey began in neurology.
Yeah. So would you say that those days in JJ Hospital were the ones you? So I've got some pictures for you again. So Jas, can you show us some of the JJ pictures, please?
Oh, wonderful.
So let's just pause that one. So this must be when? This must be what, is it 1970s, you think? Or?
I think could be a little later, I think Dr. Karthik was also, he joined us in 70s, and I think he became already, I think he did his DM neurology 3 years before. And then he became an assistant honorary as well. So I think, and this must be after he came back from New Zealand. So it was probably late 70s, you're right.
Yeah. Show the next one. So he obviously Naushir had a very big influence. You mentioned him so many times
Was.
already. Can we have the next one, please?
Oh,
So this is
wonderful.
I think a later picture, and
No, this is the 75th birthday celebration of Dr. Bhatia at the
yes,
Tata Hospital.
yeah.
So I
So
think,
there's there's Dr. Kathrak there,
yeah, indeed.
Piroja, Gajendra
Yeah.
Singh,
Turel.
Mrs. Kathrak, I think Mohit, Kini, Shirsat,
Khadilkar,
Khadilkar, Roop
Jimmy Lalka.
Gursani, and yeah, everybody. So quite a number of your proteges and followers here in this picture.
By that
Next
time,
one.
Kailash, you must have been in London, I guess.
I think I was in London by then. Yes, yes. Next one. And we got some from your Bombay Hospital stint as well. So
Oh,
maybe you can tell us. I see Jimmy and I see Petrus. That's your assistant,
KT1,
isn't
yeah.
it? Katie, isn't that?
KT1, yeah. He's the
Yeah.
secretary.
Yes.
Senior to me, he just probably just crossed 90 now,
Right.
7 now. And then
Yeah.
all the other people who are they are with me in the PDMDS, Parkinson's Movement Disorder Society. Nawaz is in London now. I'll ask her to contact you. She can start
Sure.
the organization over there. And you can see
Yeah.
Petrol Wadia and Jimmy.
Yeah.
So we have
Next slide. And I
Yeah.
thought maybe you want to talk about these two
Yes,
individuals.
indeed. Dr. Bhagwati actually joined Bombay Hospital at the same time as I did. And he was trained by Wiley McKissack, the guys, and he actually was an outstanding neurosurgeon. And I think his interpretation, like that of Homi Dastu, for angiogram and air studies were remarkable. And not only that, I might just say, for your interest, that from 1960 to 1970, he got the Lexel frame, made in India, copied it, and started doing in the peridotomy and thalamotomy in Parkinson's patients. We did about, I used to assist him a little bit, but of course that completely disappeared in 70s, when the levodopa came into existence. But at that time it was more the lesion, making a lesion. And he was very good in doing the air study and making all the parameters as to where the lesion should be done. So I must confess, there was one strange thing, Kailash, that we noted at that time, which might interest you, that when the lesion was done on one side, the tremor on the other side vanished.
Yes.
But when we did the lesion on the other side, then the tremor reappeared. That was funny. I think we must be doing something to psychiatry, which you must be very familiar with. But the other person that I must tell you about was Professor Darab Dastu. Professor Darab Dastu was a very eminent and very good neuropathologist. It's very sad that we don't have a good neuropathologist now in the city of Mumbai. And all neuropathology is concentrated only at NIMHANS, Bangalore. He was outstanding. He used to be at the Tata. In 1962, I think the ICMR department with Khankolkar, was sort of close because he retired, and Dr. Wadia brought Dr. Darab Dastu to JJ Hospital. And we had a lot of, I think you must have attended the brain cutting session.
Yes.
Yeah. So I think we did a lot of learning, and he was very, very good. We could write some papers. He was very, and he used to travel quite a lot and discuss with the other neuropathologists. So I think some of the paper on tuberculosis and tuberculomas, and also on the tuberculous meningomyelitis with Dr. Wadia were written by him. Not only that, some of the work, on multiple sclerosis, Devick's disease, which we wrote up, was with his, and also Eales syndrome. At that time, McAlpine used to call it as a variant of multiple sclerosis. But as you know, it is totally different. We know that now as the neuromyelitis optica, which the Mayo Clinic people discovered. So that was it. So I think, Dr. Dastu is joining our hospital was really right. And Mr. Vadia's picture that you showed, I think first we had Shubha Pandya. Do you remember her? Shubha
Yes.
Divekar. Shubha Divekar, who did the EMG study. And she set up the department. She was really interested in leprosy. And she did her PhD also in leprosy. She's remarkable. She married Dr. Wadia, Dr. Pandya then, and she set up the department with the plastic surgery, and also Dr. Wadia used to take her help. And then Mr. Wadia, of course, took over the electrophysiology, both at the JJ Hospital and at the Justro Hospital. So I think it's really remarkable.
It is, yes. You trained a generation of neurologists, so many of them now all successful in their own right. Do you have any favorites?
Well, of course. I think, I can't call you, in any way small. I mean, I think that I have trained you because you really on your own have become so big and such a giant. But I think the people who have done very well are, say, Sudhir Kothari in Pune. They've done extremely well. We have, Dr. Biswas. I don't know whether you remember him.
I know, I remember Biswas very well. Yes.
He did very well in Kolkata. And we also have, in Ahmedabad, we did come in contact. Dr. Sudhir Shah was not trained by me, but Ajit Sowani was. Ajit Sowani also had done extremely well. That all of them, Jimmy Lal Kaka, I think really he has been a great help. In fact, he always is sort of low profile person, he doesn't count it, but he had done a lot. And Dr. Katre, of course, was mainly with Dr. Wadia, but a colleague, I would say. I wouldn't say that you are trained, but he was a colleague. And Khadilkar, of course, was trained by Dr. Saroj Katre and Dr. Wadia.
Yeah. And in your, your academic activities have been immense, and from the MS work, the neuromyelitis, also optica, and the myasthenia. And then, can you tell us a little bit about the megaloencephalic leukodystrophy? That was something which I think you pointed it out. Yes.
Kailash, it was very interesting. These were the days when the CT scan was not there. And I saw a child. I used to see the children as well, having worked with Dr. P.M. Modani. The child came from Vellore, where the head was large. And they tried to make a ventriculography on the child, and they couldn't succeed. And he couldn't walk. Child was unstable and also cognitively down. So I made a note of that. And then I saw 3 or 4 more such children later on. So I realized that there's something unusual is happening. So I started collecting those cases. And then, of course, then the CT scan came along. Quite obvious there were cases of leukodystrophy. And then with the help of Gursahani and also Udani, so we presented these cases in a meeting in Japan. And subsequently we tried to, but unfortunately, we couldn't get the metabolic studies done. And there were papers which we tried to submit in the Athenaeum. Most of them were Agarwals. So we tried to submit to the Annals of Neurology. Asbury was the editor, but I think the referees had rejected it because we had not done the studies for Canavan disease and other metabolic studies. Although Asbury did write to me that, if you do some more work, it can be published. But, I think before that, of course, as you know, Wenda Knapp, who became a good friend of mine, had done the work from Netherlands. And she has been extremely good, taken the work completely forward. So I think it's quite really interesting that this was in the ethnic group. And with the help of Sakubai Naidu and Gorospi, who were working there in their laboratory, they could identify the gene, the special gene, MSC1 gene, in the ethnic community. Mm-hmm. So I think that was really quite interesting.
So it's a very interesting story, starting from the clinical and then coming right down now to finding the gene over a period of time. So that's really fantastic. That's the sort of thing one.
Pleased to hear. They only recently, I think Sakubai sent me a note that the French group probably, or some group, is working on the genetic basis to try and see if the gene correction can be done for these patients. So I think something will come out by way of treatment as well.
Yeah. And you keep up to date. You have the Neurology Foundation meeting, which you started. You get people coming over for the updates. That is really a fantastic thing to do, I think, to keep academics going. How did you come to do that?
Well, I think Jimmy was with me, and in 1996, we had we invited 2 or 3 people, from overseas, and we had a meeting at the SP Jain Auditorium. And then we tried to do again in 1998. I really registered the society as a Neurology Foundation. And then, of course, the other people joined in. So we have these updates every 2 years. And in 2003, I think we had it along with the Parkinson's Disease International Symposium. So every 2 years, we try and invite now about 10 or 11 international people to cover wide range of neurology topics. And I think the program is very well attended. And some of the people that we have invited have included like Dalmau, autoimmune person, Angela Vincent, we have invited her. We have also invited, in the movement disorder, Tony Lang. I think you have also come.
I've come as well, yeah.
So we have tried to invite the people who can deliver the message.
Mm-hmm.
And similarly, in the epilepsy also, we have invited, Simon Shroman and the other, people. So I think these meetings are very well attended, and the neurologists really look forward to it.
Yeah. I remember you, we've had several discussions at different places, at the American Academy and otherwise. I remember a time when you used to come back and tell us about how Japan was making such fantastic progress, such a small country doing so well. Then you mentioned China has come up. What's in your view, what is happening in academics in India? Do you think that the academic area is progressing in India? If it is not progressing, what is the reason for that, and how can we improve it?
I think well, one, of course, is that I think the number of neurologists has increased considerably now. There are excellent centers, All India Institute, eminent, Sri Chitra, SGPGI, and PGI, in Chandigarh. They're very good institutions, training a lot of good people that we have. And some of them are doing excellent work. One of the problems, of course, is that the large population is to be served. And if the people are moved out in the periphery, the pressure on them is quite high. So I find that there perhaps we lose out because then the record keeping is not there. Even some of the institutions like my own institution, Bombay Hospital, they destroy after 5 years. And the notes are not very well kept. So I feel that, but probably in due course, as the number of neurologists increases, and I think as the sub-specialties grow, my feeling is things will get better and will improve considerably. So I'm quite sure of that.
Yeah. You set up this fantastic Parkinson's disease MDS. I was just looking at their website. It's really, really, really fantastic. And for people who have not looked at the website, it's quite something to see, and lots of activities. In fact, we made a few slides. Jasser, can you show us some of the slides for that? So I think this is a really fantastic venture. Can we go on? You do the running with the marathon. We're going to ask you how you keep fit, and the dance for Parkinson's, and of course these glamour shows as well. And here you are with some of the patients. I think this is some choreographer, I gather. Yeah. So how did this come about? How did you come about setting this? I mean, this has been a big success. It's really been a major success. And the website is really terrific, absolutely terrific.
I should mention the name of Charu Sawant also as my one of the favorite students. But I'll tell you how it began. You see, we didn't have anything much to offer for Parkinson's patients. I was roped in by the working group on Parkinson's disease, by the WHO, Mary Baker and Lizzie Graham. That started in 1997. We used to meet every year in different places. And one meeting was in Tokyo. And as you know, in Tokyo, Yoshi Mizuno, I was very, and in the people who were there, they asked me that why don't I organize a symposium in India? So I said, give me, to organize such a symposium, give me 2 years. Probably the meeting was in 2000, 2001. So I came down to India, and with the help of Dr. Lal Kaka and others, I registered the society and made the NGO, Parkinson's Disease and Movement Disorder Society. And we had the constitution and various things. And then, fortunately for us, we had Maria Barreto, who had become quite an international figure. In fact, she is the co-organizer of the World Parkinson's Congress. And she has a very dedicated team. So we now have 64 support centers, in 25 states in India. And even during the lockdown period, we have considerable, activity going on. Dance, yoga, physiotherapy, counseling, I'm quite amazed. And the whole credit goes to Dr. Maria Barreto and her team. And in this context, I'd like to just mention a little bit about the Neurology Foundation also. We have among the trustees, Dr. Viraj Sanghi, who, as you know, is a very good pediatric neurologist. We have Dr. Khushtuma Mansukhani, Dr. Jimmy Lalkaka, and we got 2 or 3 others as well, from the other, for instance, finance and other people. So, what we have to do, of course, is raise the funds as well. So some of the activity that you saw with the Shamak Zawar and the others have to raise. But we have World Parkinson Day celebration every year. This year and last year we couldn't have it, but we had the virtual program. And now they are beginning to invite even the people from overseas because of the, internet. So it's become easier. In fact, more people have joined after. So I think after the lockdown and everything finishes and the virus disappears, we will probably have a hybrid meeting. We'll be able to introduce in-person meeting and also perhaps have also a tele meeting. So I think there would be some gain.
Yeah. You're famous for putting in long hours. I've known you used to take your ward round at 7 or 7:30 in the morning, then you'd be off, and I know that you used to sometimes leave Bombay Hospital at 10 or 11 at night. Now this balance between the family and your work, how was that? How did you manage that?
Oh, that's a very good question. My wife, as you know, has been a gynecologist herself. She was quite busy as well. So I feel that, I think I had to cover 2 hospitals and my own clinic. So I had to begin my rounds at the Bombay Hospital, go to JJ Hospital on time, and also be available to them if they needed me. Then come to Bombay Hospital and do the clinic and come back. But it was not so late as you mentioned. It would be around 7 or 8 o'clock in the evening that I was going there. So it was possible to do that, but to be in touch with the academics was also important. So I used to attend, as you saw, American Academy meeting, and I used to attend the European meeting. I think I have heard you in the, the
Yes.
European meeting.
The EAN, yes, and
yeah,
yes.
fabulous lecture that you give.
Thank you very much. So now some sort of quick questions. Does B.S.Singhal watch TV?
Well, I think not the news. I think no news.
Netflix.
News.
Have you heard? Have you said? Do you watch anything on Netflix?
I used to. Well, I think now I began to, because previously I never used to, have much on the television. There's not much time also. and a little bit of that. But now Netflix and also Amazon Prime, both we watch. But I think,
Right.
I like, I don't like horror movies. I also don't like, where my wife is with me. We will like movies like Crown. You must have seen Crown.
Yeah, I've seen it.
It's
Yes,
a
it's been,
very
yeah,
interesting series.
right. Yeah. Any favorite books?
Yeah, I think I'm, frankly speaking, I'm really amazed at the people who write the books. For instance, the Orhan Pamuk, the
Yeah.
Istanbul, the Turkey, got the Nobel Prize also. When I read his books, I was amazed, because I could really understand, how, the miniatures were made, how the people used to make the miniatures and how they were completely wedded to them. And, I think you learn. Similarly, Amitav Ghosh, I had not known about the connection of the Parsis, and I had not known about the poppy seeds, being
Mm-hmm.
grown, and how even the East India Company, and they were really making, all these transactions, you know. So I think there were all that trade in Kolkata was basically about the poppy seeds and bit of crop material. So I feel that this sort of the thing, the book that you read also gives you a lot of idea about the history. And I'm
Mm-hmm.
quite sure that they are having research workers to help them to get all the desired information. So really quite interesting.
I know that you like one book because you mentioned it in one of your lectures. Jess, can you show that slide, please? Can you tell us why you like this book?
Oh yeah, of course, of course. I think Siddharth Mukherjee, as you know, nowadays lives in New York, and he's a very, very famous author. He's also written about the, cancer disease about it. And I think what I liked about him was the, one, that it's not only the, you know, about the laws of medicine, and I think you got to be very observant as to what happened. I think I like the case that he described, where he has mentioned that somebody living in the Brooklyn street in Boston, where of course they're all rich, affluent people who stay, was losing weight. They did all the tests, compared CT scan and everything, look for malignancy and everything. You're not diabetic. And then one day in the lobby of the Mass General Hospital, he saw him meeting a person who was in ragged clothes. So he wondered, as to why is he meeting him. So it was quite obvious that he was on the drugs, and they did the HIV, which came positive. So I have a feeling that the this sort of a thing, his books are really very interesting.
There is a rumor that you formed a club. Jess, can you show us this slide about the club which Professor Singhal has suggested apparently to be formed? And the next slide, yeah.
Indeed. I tell you what, it's a very interesting story, Kailash. I think I had gone to a meeting of the PDMDS group only in the month of April to uh, Moscow. And, I thought that when I go there, I didn't have an overcoat. And I thought that when I go there, I'll probably buy an overcoat over there. And it so happened that even the boys section there had the overcoats, which are longer for them. But luckily for me, Oscar Gershanic, whom you know very well, was carrying for unknown reason 2 overcoats. And that one of the overcoat really, and Oscar Gershanic, as you can see, is not much taller, maybe a little taller, but the overcoat really suited me very well. And this is the overcoat that I'm wearing. So in fact, Yoshi Mizuno, Oscar Gershanic, myself, we had a good laugh and call it the club of the, short stature neurologists.
So people who aspire for that, there must be a
Membership, yeah, but you can't be too tall for us.
Yeah. What would you advice, say, to an aspiring young neurologist nowadays who are listening to you today, perhaps to, if they wish to pursue a successful career, maybe emulating you or somebody like you, what advice would you say to them?
Well, I would say one thing, of course, as you know, in India, they still have to practice and see the patients, apart from being attached to the academic institution. I would say that it's very important that they take the history themselves. The history is everything. They should not rely on the history being taken by the assistant. I would rather accept the assistant's finding, but the history taking should be, because that is, where you develop a rapport with the patient, you understand him, and the social history is also important. That is one aspect. But it is also very important to be focused on a particular, disease or specialty. And they should make meticulous notes. I think it's easier now when you have the computer. So I think it's very easy to really keep the records of the patient and have some interest. I'm quite sure that an occasional occasion may arise when one might discover something unusual. So I think it's good too. And I think I remember you're mentioning about when I heard, in the lecture series, on the inspiring doctors, you mentioned how, David Marsden used to make a note of that in a small diary about the case. So I feel
Yes.
that it's very, very important to be guided in this manner.
Yeah.
So I feeling
Yeah.
it's very important, A, to deliver the goods to the patient in the right way, prescribe only what is necessary, understand his social circumstances also, do not prescribe unnecessary medications, unnecessary investigations, do not be guided by the investigation. I think the clinical examination and correlation is more important, and not to, for instance, a person may come, and many of the patients will come and see my MRI. They don't want to tell you the history. And the MRI may show a ghastly cervical disc disease, but he might be having Guillain-Barré disease. Who knows? So I feel the clinical history is more important. So that is one aspect. And number two is to be interested in the academics and attend the conferences as much as possible.
With this advent of new technology, with the genetics, with the advances in the immune, on the antibody side, all of this is making it difficult, I think, for people to keep up. And people are even venturing to say that in the future, maybe the diagnosis will be just typed into Google, or the symptoms will be typed in and Google would give you an answer. Do you ascribe to that view?
Oh, they have a place, I'm sure. But I'm not so sure that the clinical relationship can be taken away at all. It's a human being that you're treating. You're not treating a disease. You're not treating a disease. You've got to take the whole person into the picture. Don't treat the disease, but treat the individual. So I feel that they will have a big place, of course, no doubt.
Yeah.
But I don't think that will be it. Even today, I mean, the patients with the incurable diseases come. They've already been diagnosed, But they go to another person, really, there's a compassion, empathy. They're very important. I don't know what you think about it.
No, I agree with you completely. Absolutely. I'm of that view entirely. Absolutely. I feel that sometimes, maybe I'm wrong, but I feel that sometimes these sort of things about, artificial, they will be helpful for us as an ancillary thing. But ultimately, the clinician is the one who has to deal with the patient, like you say. So that will still be required. You had an amazing career. I've just seen a message from Tony Lang. He congratulates you, says that you're so vigorous, you haven't changed over the years, and he sends his compliments. So this issue about how do you keep fit?
That's a good question. One, of course, is I make sure that I do a regular walk in the morning. Number two, of course, is that's why I'm able to join them our marathon sessions. So far I've done, but now I think Charu and Diggy and some other people and Jimmy, they really pedal Bhatia, catch hold of me and make me sit down. They don't let me complete it. But I think it's very important that I continue to do the walking. I also am very careful about what I eat. I think it's very important that eating should be, and have adequate sleep. That's all.
Do you have any regrets
In life,
in
I mean,
life, in general?
in general. Well, I think, frankly, from that angle, I'm quite satisfied, the journey that has been. I think I always feel that I was never ambitious to achieve anything. And therefore, I think from that angle, I do not have any regret. Maybe I could have done more by way of, some degree of clinical research, maybe that sort of a thing, but that was not really possible. But otherwise, I think I don't have any regrets. I've had, I must say, I must thank each and every one. Whatever one does, there's so many people who are helping you. I've been very fortunate in that manner that people have been very, very kind to me, very nice to me, extremely good, And I've also believed that, whatever I can do for the society of the people, that will make me happy. And that is my sort of, always a theme in my life.
India is going through a very difficult time with the COVID situation. I wonder if you have any thoughts about that as we come to the end of this interview.
I think my feeling is unfortunately, my country is very large, indisciplined, and people, there's a shortage of things, naturally. There's a blame game as well. I think the important thing is the vaccination, and I think a strict discipline about the wearing the mask, keeping a distance, not having the parties, even when the lockdown eases. So that's what I think that I think my son Manish always says, all pandemics die down after 1 or 2 years. So I think this will also probably go away.
And let's keep our fingers crossed, and yes, our thoughts with everybody. It's been a great pleasure chatting with you, Dr. Singhal. Really fantastic. And if you have any last comments or any, so please say so.
No. Well, I think the only thing is, I think I'm quite happy about the family as well, because the children have done well. The daughter is in
Yeah, we have a picture of the family, do we? Jess?
Oh, well. See, that's the Boston group, my Anish.
Yes, he worked with me, Anish, for a short time. He visited me, rather.
Unfortunately, he had to come back because his mother-in-law died. Otherwise, he would have been there for a longer period. He's in Boston, of course. His son and children are doing very well. And daughter is in Chicago, of course, doing the work on myeloma. And the children have been extremely good. That's why I have no regrets at all. I think the fact that they went away to America also, we don't feel, because I think they are really very loving, and they always call us all the time. Not only them, but even the grandchildren. They're pretty grown up as well. So I think I'm quite pleased on that score as well.
That's terrific. And thank you very much indeed.
So only I have to ask you about your cat and your daughter.
My daughter is doing well. She's doing a master's at UCL. And unfortunately, our cat passed away. It was 17, and yeah. But yes, but fortunately, the family is okay. Thank you very much for your concern.
I'm sorry.
Okay, so I don't know whether we have any questions. Have you got any questions? Yash, can we play some of the last slides, please?
We are very
Some
proud of you,
appreciation.
Kailash. We are very proud.
Different people.
Yeah. Yeah, you can see Mrs. Our Jimmy's wife as well. These are the group of the PDM there. You can see we are Sanghi as well. That's wonderful. Jimmy is there. Pedro Guardia is there. And the group is there. And Maria Barreto on the extreme right of me. And Charu on my left. And Pedro Guardia on the extreme left. And, I think Maria has been a great leader, extremely great leader, and a very dedicated team. It's quite amazing to see how she works. And the PDMDS has grown so big, mainly because of her. And of course, Petrus, Charu, Jimmy, they gave a lot of support. Yeah.
Okay.
Everyone, all the there,
Another
Mohit is there.
Mm-hmm.
I must say we are very, very proud of him as well. He has also done extremely good work, and Anu Agarwal is there. So I've been really blessed with very good friends and people. Really, it's quite amazing. I don't know how you got all these pictures. From where did you get? Quite amazing. Thank you very much.
Thank you. Thank you.
Thanks, Kailash. Thank you very much, and thanks, Rishikesh, Ellie, Loveleen, and Prashant. Thank you very much. Thank you, everybody who has been, listening to this. I think. Thanks.
Thank you, sir.
Okay.
Thank you so much, both of you. It's really a pleasure to have you both. And as part of MDSI, we would like to thank you a lot. There could be no one else but Prof Bhatia who could have interviewed such a big giant for us. Prof Singh.
He is a big guy.
No one could have done this better than you, Prof Bhatia. So thanks a lot.
I like to one mention Vinay Goyal. Vinay Goyal. I think he has also come back as a Parkinson's disease specialist. He also was one of the very good persons. Okay, all the best. Thank you, Loveleen. Thank you.
Thank you.
Jess.
Thank
Thank
you so
you.
much, Professor B.S.Singhal, sir, and Professor Kailash Bhatia for such an incredible, wonderful evening. And thank you so much for such kind words of enlightenment. Thank you so much, sir. Thank you. We are honored to have you both. Thank you, sir.
Thank you.
So here we end today, and stay tuned for the next episode with MDSI Speaks to the Legends. Good night all. Bye.
Bye-bye.
Bye, good night.
Bye-bye.